This is Bertalan and you're watching the channel of the Medical Futurist. Hey guys, this is Bertalan the Medical Futurist, and we are here live at the Budapest Science Center, which is a great place if you're a science geek or a nerd and you want to spend a whole day here learning about science and pregnancy and all these amazing things. But the reason why we are here today with these amazing guests is that I had a course at Semmelweis Medical School last semester. It was called Lesson to Digital Health. And the way I designed the course and the reasoning behind that was that we need to give a chance to every medical student worldwide to learn about digital health, how technologies will shape the future of the medical profession, how empowered patients will require us to deal differently with them, and how to be at home in the jungle of digital and healthcare information. So first, if you don't mind, I would ask you to just introduce yourself and say a few words about why did you apply to the course?
Avid Babakani. I'm a second year student and I applied for this course because previously I was more involved with the engineering aspect of technology and I had those previous experiences, but since I started medical school I would like to know how to gain the knowledge to apply those engineering knowledges to the medicine, and I thought it would be very interesting to know what are those scientific aspects and bases could apply to medicine.
Thank you.
So I'm Ben. Why I came to the course was, actually I was probably waiting for some kind of a course like this to open in a university. I'm really into technology, and of course I love medicine, and I just wanted to finally join these two worlds together. So the second that a friend of mine, by the way, told me that this course is open, I just emailed you straight away, and I'm getting in, I don't care, you know? So yeah, that's why.
Thank you.
Hi, my name is Boldizsár Gyöngyösi. I'm from Budapest, Hungary, and I'm a third year student. Well, basically, I'm a huge science fiction fan like you are, and I wanted to discover what a course that doesn't use strict values and want to teach you lexical things, and I wanted to see what it's like. I wanted to discover, what the basics of the digital medicine world are. I wanted to see all the aspects of it, and I was very curious because I wanted to see how technology influences people now in the new era of using medicine at home and stuff like that. So
Thank you for that. And I think I have to be grateful that the exams are over, so you can all be here.
Yeah.
Congratulations. Great job. We had a makerspace workshop. We had the business projects thinking about how to create new ventures into digital health. We talked about these gadgets and virtual reality and all these. Did you find any of these particularly useful in your studies or in the way that you want to see yourself as a future physician? Or it was awful all the way around?
Definitely not. Definitely not awful. I really liked the classes where we had to, think literally about the future, our future, and how we're going to implement our skills in the future. Like, by the way, the project that we did at the end of inventing something new or something like that, I really connected to it. It's basically why I came also to the course, to see how I can conjoin this technology and thinking and inventing stuff and thinking about problems that will emerge in the future and how are we going to solve them. So I found that very useful actually. So yeah, I really enjoyed this.
I got feedback from some of you during the course that you would like to see more of these, not just talking about stuff like the philosophical background of technologies, but let's find out how to find solutions for all these problems together, and that's why I asked you to work in small groups, more and more often. Yeah. Any technologies you were more interested in than in the others?
I think not just the technologies that we discussed, but the whole idea of being able to have that option to be creative, in a class. It was an incredible experience because when we go to university, we're just so much having the weight of the studying and the theoretical subjects on our shoulders that we sometimes kind of undermine the whole creativity and the ideas that we came there to kind of embrace. And I think for me, at least, this was an incredible chance to just get away a little bit from this theoretical subject and be able to focus on more creative stuff. And we discussed a lot of technologies in class, like the technological inventions in stethoscopes or different kind of like blood pressure measurements and those things. I think those gave us really good ideas. Like previously, I wasn't that informed about the technologies that have been done through medicine. You know, maybe you see the technologies in general, the inventions in computing and those kind of things, but you're not that involved with the ones in medicine. I think as a medical student, it was a great opportunity to see how those computing inventions kind of have been incorporated into medicine.
So you're saying that not all medical subjects are as fun as this course?
Definitely not.
How is that possible?
I mean, our homework was to write science fiction. It doesn't get better than that.
What did you have any subjects
it was very interesting because after a few hours of the course, I got so submerged into this whole topic of the future of medicine that I would start debating about the ethics of it and the problems of it with my friends, with my roommates, with my teammates, and it was interesting and sometimes kind of sad to see how young people who are about the same age as me don't agree and think that the 3D printable cast is useless and the medicine is useless and all the great, the EKG, the faster things, the easier things, the cheaper things, and it was just so weird to me, and I kind of became like a small pioneer of this
justifying.
Yeah, just to show how kind of the school makes us think in a typical way, and you broke that barrier for us. So
thank you for that. That's how medicine works. You come up with one invention and then forever use the same thing. Obviously not. So it's unbelievable. And that's the notion that we have to discuss. We had to discuss in every lecture, that it's just not enough to know about technologies if you don't bring them into practice yourself. I mean, you can expect your government, your organization to do it for you if you have decades to wait for, but if you don't, then just be bold and do it yourself. I have to be honest, I didn't come up with the idea of writing a science fiction short story. I told you that I was a student at the Harvard Extension School course, and there that was the homework, and I loved that. And I'm very lucky that you love that too. Maybe that's how I pre-selected you out of the many applicants first. But for a science fiction short story, the makerspace workshop and all these, I tried to change the way we bring forward thoughts and transmit thoughts in a course. Any different or similar methods that you can find in the lectures or subjects? Or what? Let me to put it this way: how would you like to see medical education shape while technology is so massively shaping how we practice medicine?
Start. Okay, first of all, we talked a lot about this in class, how everything is old-fashioned and stuck, and medicine and med school, I mean, the whole combination of it is stuck, way stuck behind. And in your classes, we got a chance to see a bit of how we can dream into the future, what we want it to look like. Medicine as a subject as an occupation, as a whole, and obviously med school. I think med school is getting there much faster, by the way, than medicine, because there are much more younger people in the institute trying to push forward with research, with new ways of studying. If it's tablets, if it's smart walls, and I don't know what. So I do think it's getting there. Now at the end of the studies, I think that there has to be, this is an obligation of more practical training in med school. And with the new technology that is arising around us, which we saw in the course, it's much more possible now. If it's these VR glasses or augmented reality or anything you can imagine, and it's really beneficial, obviously, for all of us, and it's happening like right now, and we can really. I hope that we'll see it in med school in the upcoming future, at least. So yeah.
Any thoughts on that?
I think it was a great opportunity because we had a chance to really feel the involvement of technology in our studies. And I think not only for medical school, but for every other science out there, technology is not just another subject. It's kind of a base to everything that we do, from architecture to medicine and everything else. So for us to have the medical knowledge and be able to feel that technology and study more about it and kind of be involved more in it, it will help the people who are involved with the engineering section also to use their knowledge and kind of combine that and create a new invention which will be more beneficial. Because you see, many times we have like a medical invention and it's mostly designed by biotechnologists or people who are more involved with the engineering section, and you see when it comes to practical application there are always some lacking, something that it's missing. But I think having the medical knowledge and being able to learn the technological basis and the engineering basis will help us to have inventions which are at least 90% complete rather than 80 than 70. So I think that was a great thing, and I really hope to have it more not only in medicine but in every aspect of our education. So
thank you for that. Any
Well, basically, I also agree that medical school has to be more practical, but in the sense that it has to be a bit more less. So, you need to study, and this, doesn't depend on us, but you have to kind of see what you're going to use and what you can potentially use in your expertise in your area, and how you can dig yourself into those devices and technologies. Like if you want to be, I don't know, a gynecologist, then you're gonna search for those businesses or gadgets that help your everyday life or your diagnostics. So it's hard for a medical student to break through because they're so trapped, I guess. So it's kind of a devil's circle, I guess.
Any thoughts or suggestions for youngsters who are thinking about getting into medicine, but they might be afraid that it's going to be too technological and maybe they're not even so useful at all? So maybe future radiologists might think that artificial intelligence might become so great at image recognition that they might become obsolete, which of course I don't agree with, but that's from the news, that's the kind of picture they think. Yes. Any suggestions for those youngsters?
Yeah. Go ahead.
I'll go first. I'll go first. Yeah. Well, as you said earlier, definitely the main problem is first of all that at the end of the day, medicine and technology develop faster than humans can, adapt, and we can't always adjust to that fast enough, and therefore there's a big gap in how we think. There's a big gap in how it's financed, and I think a big motivation for youngsters, that was the question, right? Would be if they're going, like a doctor, what does he need to do? He has to study a lot and use that knowledge to always heal people. But there are some different mutations, different sicknesses, pathology that we were talking about, and it changes, and you have to study it, and you have to, throughout your years, always change. So I don't think that's kind of a cheap excuse for me to say, oh, that's hard, that's, it's technology, I don't know. I myself was in still a geek, or don't. I'm not a big techie. So I'm
the processor.
Yes. No, I'm not a huge tech guy, but still I'm here.
Yeah.
So you have to, kind of break out of your comfort zone.
Yeah, adapt.
Yeah, adapt. I mean, you have to look for what's your potential, what they're looking for on the market as well, because you want to, adapt. Like, I don't think radiologists will cease to exist, but you need the human touch. But you always have to keep your eyes open. And
I think the word that he used here that is the most important is adapt, and the whole field is adapting right now to all science basically around it, and it's obviously medicine is adapting, and we talked a lot about this and about this ivory tower that the whole knowledge once was enclosed in the hospital. And you can only get to it if you would open the doors and the doctor will explain to you or whatever, or you get into med school. And now it's not like that. And this is exactly the adaptation that we're talking about, because medical students can learn medicine not only in med school. This is the really nice thing. And I walk now. In the last year, I was doing some rounds in the hospital. And I think 30 years ago, doctors that would do rounds in the hospital, they would see a patient and they wouldn't know what the disease was or how to diagnose or whatever. They would go back to the library, sit in the books, study it, marker it, I don't know what. Now, I just open my phone. I have a really nice app, I'm not going to say it. But, and you have everything. You have everything there. I don't think it replaces you, but it's right there. And this is me adapting to the new age of medical students, or medicine in general. So I don't think anyone should be afraid, because the new generation is growing into this change. I mean, it's not that they're 80 years old and I'm asking them to use a smartphone with an app and they don't even know how to turn it on. It's basic stuff, and this is how medicine is gonna look like in the future. It's not gonna be the nick, like we talked about.
Yeah.
This is how I see things. So I don't think anyone should be afraid or anything like that.
Any final thoughts on that?
I completely agree. I don't really think that thinking that robots or any sort of artificial intelligence may replace us is a good excuse to not be involved with medicine. I think that having that level of intelligence by artificial intelligence is possible, to be able to hand over some of our work, some of our tasks to them. But that's a long-term idea. That's not in the near future, at least. Not so near, not at least in a couple of years. But I think the whole unknown thing, that what will happen, it's kind of always what frightens humans. So you don't really know, and what you don't know, you're always afraid of it. And when we reach in that level of having that much of intelligence, we can prepare the basis from now to have them as our co-workers and as a help, not necessarily someone who will destroy our lives and blow up the planet. So I think the main purpose and the main base of design of the whole artificial intelligence and the robotics is to help humans, and that's the main purpose of their creation. And I think even if they reach in that intelligence, if we put the bases right, it's hopefully not going to turn around us and be that case. But I think there's always a supervision of human needed, because we see in many cases now you have robotic surgeries, but there's still time when the robot doesn't work and you always need the doctor to hand in. So don't worry, we're going to continue living.
This final thought is so great. I think viewers will think that you wrote it in advance.
No, I just ran here, so.
Thank you so much for the discussion. Hopefully this discussion will help people around the world, lecturers, to bring this course to their own medical school, because now we make this course open access worldwide. So if you're a lecturer working at a medical school and you want to bring the knowledge, the approach of digital health to your own students, please reach out to me personally, and of course at no cost. you will be able to get the whole curriculum, all the methods, the formats, every content in the course. So because we need to give the chance to every medical student worldwide to learn about digital health. So thank you so much for being here.
Thank you.
For
And
having us.
again, thank you for watching. Bye.
Thank you.